Member for Elmwood-Transcona.
Thank you very much, Madam Speaker, and it is a pleasure to rise and speak to what I think is a very timely motion on Pharmacare. And for the benefit of those listening who haven't already heard what the motion reads, I think it's worth it to read it into the record. That given that millions of Canadians lack prescription drug coverage, and given that overwhelming evidence, including from the Parliamentary Budget Officer, has concluded that every Canadian could be covered by a universal Pharmacare program while saving billions of dollars every year, the House call on the government to commence negotiations with the provinces no later than October 1st, 2018, that is a year from now, in order to implement a universal Pharmacare program. These kinds of common sense initiatives, frankly, Madam Speaker, are one of the reasons that I got into politics. It's about trying to help ordinary people in their day-to-day struggles with affordability, and it's good public policy. It's good public policy because it helps deliver help to those who need it in a more effective way, and it's good public policy because it also helps save money. And I just want to let you know, Madam Speaker, I'll be splitting my time with the member of Essex, from Essex, who will have more to say on this, I'm sure, too. So this is exactly the kind of public policy initiative that government should be looking to take, I think, regardless of where they stand on the ideological spectrum, because nobody should be ideologically opposed to helping people out and to making the things they need in life, not the things they just happen to want, but the things that they need to live a healthy life. And I don't think anyone is ideologically opposed to doing that for less money. And what we heard from the Parliamentary Budget Officer in his report, which is only the most recent of a series of reports that have been published over the years. I'm more familiar with the ones published in the last 3 years or so, but reports on Pharmacare go back decades, Madam Speaker. So when I hear the Liberals pretend that somehow this is a new issue and, you know, there's currently a parliamentary committee looking at it and, wow, isn't that great because it's the first time and we need to absolutely know what's in there in order to pass this motion, which only talks about beginning conversations with the provinces. So it's not a motion that would prejudge or preclude action on any of the recommendations of the report. It would simply signal a commitment on the government to actually do something about Pharmacare instead of just talk about it in the House. I can't really understand how they can get up in this place and make that argument and look at themselves in the mirror, because the need for Pharmacare has been long-standing. I invite them to come to my riding and talk to seniors and young people, frankly, who need medication in order to go about their day-to-day life and are struggling to afford that medication, and tell them it's too soon for a national Pharmacare program. And it's too soon to start a dialogue with the provinces about how it'll be paid for and what the details are. Those are important, but the bottom line is that whichever government ends up paying for it, they're funded by the same people. They're funded by the Canadian taxpayers. They're funded by the people who have to pay for those drugs. So when we hear from the Parliamentary Budget Officer that right now Canadians total are paying around $24 billion a year for prescription drugs, that those same Canadians, by having a different level of government pay so that it's more coordinated and whatever else, could be paying $20 billion instead. That is, for those who struggle with the math on that, $4 billion less per year spent by Canadians on prescription drugs. I'm baffled that it's a motion that doesn't enjoy the support, frankly, of the whole House, but particularly a government that styles itself as progressive and wanting to help people and wanting to help the middle class. I do want to raise a particular example of a woman from my riding. Carrie is a young woman. She says she's part of the Faces of Pharmacare campaign, and I would encourage people listening at home and members here to check out Faces of Pharmacare. Google it. It's stories of Canadians across the country that are struggling with prescription drug costs and calling for a national Pharmacare plan. She says, the 4 asthma medications I take keep me relatively healthy, and being diagnosed with severe ADHD in my early 20s, ADHD medication has been positively life-altering for me. My medication is not fully covered by the Manitoba Pharmacare program, but with assistance from other programs, I'm able to cover the full cost of the name brand medications as my doctor has prescribed. This adaptation allows me to feel and function at my best, both in traditional employment scenarios as well as in self-employment. Without Manitoba Pharmacare, my prescriptions would have cost 24% of my income, nearly a quarter of an income which a totally healthy person would not have to pay. And a national Pharmacare program could do more to assist Carrie and people like her who are struggling to be able to afford the medications they need, as she rightly points out, to participate in the labor market. So I mean, we're talking about reducing the kind of sticker price cost of the drugs, but there are other costs that we're incurring economically in terms of lost productivity that are not measured by the PBO report, but are very real when people can't afford the prescription drugs that get them going. And I've talked to a lot of seniors in Elma Transcona as well, and it's clear that seniors who are on a fixed income, if they're just on the CPP and they're relying on GIS, are not able to afford their prescription drugs. And having a national Pharmacare plan would make those drugs affordable for them and would take away one of the many pressures that people who don't have enough income face. They're facing those pressures when it comes to housing. They're facing those pressures when it comes to food. One way that we can help, that's concrete, that makes sense, is to establish a national plan so that the money we're already spending on drugs, by virtue of coordinating our purchase in a different way, can be less. And that means more money for other things. And to the extent that a lot of the people that would benefit from a Pharmacare program are people who don't have high incomes, that money back in their pocket, whether it's refunded by the federal government or the provincial government or the municipal government, or it means a lower cost at the drugstore for certain other drugs when they go to purchase them, however the money comes back to Canadians, what we understand is that $4 billion at least, and some other studies say as much as $7 or $11 billion a year, are going to end up back in the pockets of Canadians. And when you put money back in the pockets of low-income Canadians, that's money that gets spent in the community. It's not money that goes off into a tax haven somewhere. It's not money that you don't get to capture because there's a CEO stock option loophole that they're taking advantage of. Madam Speaker, that's money that goes back in their pocket and it gets spent at the local grocery store. It gets put back into the public transit service of the municipality that they're in, because those are the kinds of things that people are struggling to afford in Canada, and that's exactly the people that the National Pharmacare program would help. So what are the arguments that we hear against it from the other side? I mean, it sounds to me like the government is agreed that people are struggling with the cost of prescription drugs. They don't seem to deny, although there was some allusion that like maybe the PBO report isn't authoritative, or we need to examine the study ourselves and then pronounce on whether or not the Parliamentary Budget Officer did a good job. Maybe he's off by $4 billion, in which case there's a net zero effect. I don't know. As a Liberal backbencher, I'd like to redo the work of the PBO. I don't know what kind of resources they have in their office. I'm willing to take the Parliamentary Budget Officer at his word. And then they say it's too fast. Well, geez, the Liberals were calling for this in 1993, and the NDP much longer, and Canadians who are struggling with the cost of prescription drugs have been calling for this much longer. There is no way to implement a Pharmacare program today, tomorrow, a year from now, that's too soon. We're way past doing this too soon, Madam Speaker. And we want the government to support this motion. That's why the motion simply calls on them to convene a meeting of the provinces with the federal government within a year. That gives a lot of time to prepare that meeting, to get into all the details. And they're right that there are details to work out about this, Madam Speaker. But there are details to work out with respect to the legalization of marijuana as well. That's a complicated issue. That involves Canada's commitments under international treaties. That involves discussions with the provinces. That involves discussions about how much you're going to tax it and where the revenue is going to go and to whom and how old people are going to be in order to be able to smoke in their province. That was something that they said in light of others who said, that's too complicated, you're moving too quick. They said it's a question of political will, and we're going to get it done. Well, Madam Speaker, I don't understand on an issue that has been decades in the making and hurts the pockets of seniors and others who are struggling to afford their prescription drugs, why they don't have the political will to start this discussion as soon as possible, bring the provinces around the table, and get it done. They're doing it on other issues, and they ought to be doing it on this one, Madam Speaker.
Questions and comments? Questions et commentaires? The honourable member for Vancouver Kingsway.
I'd like to congratulate my honourable colleague from Transcona on an outstanding speech, and he made several, I think, overpowering arguments and comments. You know, the amount of deflecting and excuse-making and straw person arguing I've heard on the government side of the House today is something that's almost unprecedented. But you know what I don't hear? I don't hear a single Liberal stand up and disagree with the two fundamental realities in Canada right now. Millions of Canadians can't get pharmaceutical coverage, and number two, a universal pharmacare system would save billions of dollars. Now, my honourable colleague pointed out that in terms of the details of working that out, of course we have to sit down with the provinces and work out, you know, what kind of formulary would we have, how would the cost be shared. But the bottom line is this: whoever is paying for pharmaceuticals now will still be paying for them after universal pharmacare, but they'll be paying $4 billion at least less. So I'm wondering, since I can't get the Liberals to explain how there's a problem with that issue, could my honourable colleague explain if he sees any public policy argument against that proposition?
The honourable member for Elmwood Transcona.
I mean, I think what's shocking is that there is no argument against it. Saving $4 billion a year is a good idea. That's money that goes back into the pockets of Canadians that right now is going in the pockets of big drug companies. And those aren't the people that we're here to defend. I don't know why they see it as being their role to defend those guys through inaction, if not in word. And I do want to speak just briefly to the comments my colleague made about what we're hearing from the other side. I mean, it's all well and fine if we had no sense of history in this place. I think what the government is saying, you might say, let's give them the benefit of the doubt. They say they're working on it. Okay, well, let's give them time to work on it. I mean, actually, even this motion does give them time to work on it. So, I mean, nobody's being unreasonable on this side of the House. But the issue is, when you look at the Liberals historically, in terms of their commitments in '93 for a national pharmacare program, the fact that they had 13 years to do it and didn't even try, and then this particular government around other commitments like electoral reform, where they strung this House along until they ultimately said, yeah, we were never really committed to it in the first place. There's no reason to take them at their word when they say this is something that they're going to get around to.
And comments, the honourable member for Oakville.
Thank you very much, Madam Chair. So I wanted to thank the honourable member for his remarks. I'm a new politician. It's unfortunate that on an issue so important to so many Canadians that there would be such politicization of this issue across the ranks. I think if ever there's a time for parties to pull together and work together for Canadians, it's not an issue like a national pharmacare program. Having said that, one of the complexities we were dealing with at the committee was on, would there be a national or would it be provincial and territorial formularies? And that's a very important discussion, because provinces and territories may have very different decisions and thoughts on what they would include in their formulary. What concerns me is I noticed in the motion that the member took great care to read into the record. They've decided not to include the territories in these discussions. And I think if the decisions are made by the provinces that there should be provincially unique formularies, I'm not sure that the territories are sufficiently ready to deal with formulary development. And I'm wondering why they chose to exclude territories from the motion.
The honourable member for Elmwood Transcona.
Well, I acknowledge the member's point that discussion of a formulary is an important discussion to have. But there are actually great precedents for working towards a common formulary. So the common drug review that we had in this country for years actually served as an expert base. It was a federally run organization that provinces largely deferred to in the composition of their formularies. It wasn't binding, but that was a structure that was already in place. Some damage was done to that structure in the previous government. So it is a legitimate conversation that has to be had. But there are models for how to come to agreement. The provinces and the federal government did that largely with the CDR process before. And so that's something that needs to be done. That's why this motion allows for a year. And it also allows in that time to be able to bring into the discussion all of those people that ought to be at the table. And we wouldn't want to make the perfect the enemy of the good here, Madam Speaker.